All right, welcome back to the Blue Room. The rumors might have told you this is like the best room, so we're glad y'all are here to see it for yourself. In all seriousness, we're excited for our final 3 sessions before we get ready for our networking break, which will start about 4:30. So to kick off our final set of conversations today, we are going to have a chat about how we all remain competitive within this new healthcare ecosystem landscape as we have new entrants coming in from diverse industries that maybe haven't been part of healthcare in the past. And as I reflected on this, I think it's competitive and relevant. How do we stay relevant as healthcare evolves? And so we have a fantastic panel of experts who are going to share more about this topic and will be moderated by Jodi Rosen, who's Vice President of Innovation and Digital Strategy for the City of Hope. So Jodi, if you want to come on up with Tarun, David, and Derek to start our chat. Thank you, guys. Yeah,
Thank you.
Let's applaud. Yeah. End of day. Welcome, guys.
I think I'll take this seat if that's okay. Great. Okay, so it's 3:15. So hopefully this will be a really engaging conversation because we've got 3 terrific people on stage with me today, and it's lovely to see you all. I'm going to do just a quick introduction of my colleagues, and then we'll get started. So first to my left is Derek Streat, and Derek is CEO and founder of DexCare. Next, we have David Higginson, who is EVP and Chief Innovation Officer at Phoenix Children's Hospital. And then finally, at the end, we have Dr. Tarun Kapoor, who is Chief Digital Transformation Officer at Virtua Health. So thank you, gentlemen, for being here with me today. Really excited. We continue to see technology disruptors, payers, providers, young new companies. Our largest retailers obviously are in this space, and they're all unified by one area. Their vision is to really transform the healthcare ecosystem, and we're going to be here to talk about it. All of these disruptors are investing billions of dollars in healthcare, which has resulted in disruptive market share acquisition across primary care, concierge medicine, specialty care, and obviously we're moving a lot now into care at home as well too. According to a recent survey of leading health systems by health management administrators, 82% of health systems plan to increase their spend on their digital front door in 2023, in this year alone, which is really remarkable for those of us in health systems when you think about it, the cost pressures, and so much of the work that we're all trying to think about in terms of reduction in total operational spend due to so many severe pressures. And this can obviously, these pressures can be contributed to some of the challenges we have within our workforce, challenges we have with working on automation, and when we think about consumers and what they have done to change healthcare delivery, there's obviously those pressures too. So we're gonna open up our conversation today first when we think about all these disruptors in the digital health space, just by saying a little bit about what digital health means to each of us in our role. Many consumers, and not the folks in the room today, but have begun to think of digital health as synonymous with either virtual care or telehealth, which I will talk a little bit later about virtual health. But I'm really curious to learn, how your organization defines digital health. And Derek, we'll start with you.
Sure. Thanks, Jodi. We use the term digitally enabled in our organization. So we work exclusively with health systems. We help them orchestrate demand and supply, so patient kind of demand, and then health system resources in a way that kind of works for everybody. And when we look at things that way, we see digital enablement everywhere, right? So we're very focused on access, but so I'll look at it through that lens. But it's really, it does include virtual care, and I think often people tend to think of it as like synchronous virtual care, but there's async as well. There's how I learn about and find a way to get in front of somebody in an analog place, in an office, how I even just get information that allows me to do self-care, preventative care, things like that. So in our world, in our view, kind of digital enablement is if I can do anything that involves bits and bytes to get access to care, it's digitally enabled, which is kind of everything at the end of the day.
That's so true. David, thoughts?
I think if you took the word digital health and asked people in our organization, maybe 4 people in marketing would have a clue what you were talking about. The majority of people will be like the couple that someone mentioned earlier today. What the heck is digital health? For us, what it really means is taking the friction out of the process. Any time where families or children, in our case, are struggling to get through administrative tasks or get the care that they need, then we try to use digital technology to get rid of that friction. And the other part is really kind of meeting them where they're at, especially during the pandemic, is if a family wants to book an appointment with a phone, then they should be able to book one. It shouldn't be us to tell them you've got to spend an hour on the calling us up and do it our way or no way. So a lot of it is just kind of changing our processes to kind of meet where they want us to be, and rather than saying, okay, this is the prescribed hour-long appointment, come in, park a car, for 10 minutes with a doctor and then you get a prescription. That's not what people want anymore.
Jodi, thanks for that. And couldn't have teed it up any better with from Derek and David. I try to think of the word digital, and it's 3 separate words in there, at least that's how I try to think about it. There's digitize, digitalize, and then digitally transform. And I think, and it can be any of those 3 things to different folks. I think, going from analog to binary, just taking your X-ray from a film to an image that can be shared simultaneously, part 1. To David's point, changing the process around it such that folks can actually utilize it. But I think the key opportunity for us, quote, incumbents, is then how do we create new business? And because, the statement we try to use inside of our shop here is, if you don't want to be disrupted from the outside, disrupt yourself. And so that, all those 3 phases have to happen. And I think just when people think about it, just challenge you to think, well, what part of digital are you talking about? That's how we try to talk about it internally.
That's great. That's great. I think those 3 levels, I'll kind of go back to kind of the digital ambition matrix or framework that I think 2012 Harvard Business Review really kind of began to push out there. And they really talked about core, adjacent, transformational, right? And I think those are sort of these 3 levels. And when you think about kind of as an enterprise, as a business, where do you want to effectuate change? Is it with your current consumers using some of your own resources? Are you starting to grow out exponentially into new markets, adjacent, and then really those net new opportunities? Those begin to sort of feel about digital innovation at 3 layers: core, adjacent, transformational. So if I kind of take digital health and then move it 1 step further to this sort of notion of digital innovation, can you kind of talk about what that means to your organization? And Tarun, if you want to maybe keep going. And
I could take a first pass at this. And so I really like to break down, what do we mean by innovation? Right? Because and I apologize if folks in the room, you have an innovation center. I really struggle with that concept of a place you go to do innovation, right? That's typically, in my mind, not where innovation happens. Innovation's happening at the edge, or at least, it can be codified and dissected in a center. But, that's just not how I think about innovation, but I use this concept of innovation without adoption is simply experimentation. It's the adoption of the experimentation that's the change here. Right? And again, tying back to, quote, the disruptors, what are the disruptors good at? They're cold-blooded executors. Yeah. And in healthcare, we have historically, in traditional healthcare, we have not historically been ruthless executors. And I think that is basically where we're at right now, because for the first time in traditional healthcare, there are going to be winners and losers. And last year, there was a lot of losers, right? And 2 or 3 years in a row, we're going to see a shrink of the IDNs. So it's a very trying time.
Anything about innovation?
I think just kind of building on that same point, for us, innovation is not technology. So there's a lot of people, vendors here today, who are selling technology. It's not what we classify innovation at all. This is about making cultural change in our organization. I'll give you a couple of examples. Many of you probably think that you have a solution where someone can book an appointment online. We all say, yes, we've got that, especially if we're in the marketing department. How many of those cases where there's only 20 slots a week that the doctor's opened up for that system because they won't open the rest of them up? The failure there was convincing the provider that you should have no hidden slots. Every single appointment in every specialty and every disease should be open if you're going to do that. Now that takes huge amounts of change to make that culture happen, That's where the innovation happens. And unfortunately, it's boots on the ground every day, twisting that person's arm, arguing with them about why they should change, why would the physician let go of control of their schedule that they've had for 25 years, and really listening to all the different points they have and trying to drive down the middle. Just showing up with a piece of technology that you bought from someone and saying, okay, we're going to do this, and a year later you've got 100 appointments in it, is not what I call innovation. And so I think we've tried to evolve from let's go out and innovate, let's go out and buy something, to let's actually make a difference, and at the end of the day, judge it by how our families and our patients use it.
So.
What I would add quickly there is I totally agree, innovation shouldn't be technology. And if you want to get a mutiny on your hands from your IS department, tell them that they're not the innovators and that they're going to just keep the wheels on the bus. Completely agree. To define it with execution, change management. I guess the word I would add to it then is courage as well. We're going to get into disruptors and so forth, and those kinds of things that Tarun and David mentioned. I mean, those are probably the hardest problems to solve in, forget about even just healthcare, any kind of organization. And so having the courage to try to do something different and change the status quo is I think a necessary requirement of innovation. And there are certainly health systems we've seen that we work with and ones that we don't, that we'll look at someone like an Amazon who is bringing this innovation to the healthcare world, even though what they're really doing is just running the same playbook they've run for a long time. It just looks really innovative in healthcare. And a health system, if a health system looks at that and says, we'll just let them do all that top of the funnel care and we'll just sit back and do specialty care, for example, they risk becoming a price taker, in that kind of a space. And so you've got to have the courage to just kind of not go the easy route and actually try to defend your world too.
And if I could just add one other thing,
Yeah.
so you can tell I like formulas. Formula sums it up. Someone stole it from someone who stole it from someone who may have stolen it from Hal Wolf at HIMSS. NT plus OO equals COO. I well have heard it. New technology plus old organization equals costly old organization.
Yes.
Right? And what ends up happening, and we'll mention this to the vendors out there, is you get blamed because the NT didn't solve the OO. And you need to think about that. Am I just selling NT, or am I actually offering some opportunity to change the OO piece of it? Because that's where the blame's going to come to. Oh, that technology just was busted. It was the wrong technology. No, the implementer was not doing their diligence in doing their work. And that's by far the hardest part. 85, 90% of the work is on the OO.
Absolutely. That's a formula we all need to memorize. So building on all of this, and we've already kind of now mentioned Amazon, we know that there are many non-traditional players out in the field. And when we think about the primary care market alone, which is a $260 billion industry, it's traditionally today still dominated by fee-for-service, for the most part, players. But it's changing rapidly, right? It's changing as it relates to, we said, Amazon and One Medical. It's changing related to Walgreens and Village MD, CVS, Oak Street, right? As well as all of the younger disruptors. And what you called them, I think, was cold-blooded executors, right, in the space. I like that. It's projected by 2030, if you guys haven't seen this statistic, that non-traditional players will have about 30% of the primary care market share. It's huge. So to all of you, over the past decade, there are many new entrants into the healthcare ecosystem. DexCare's is a new entrant. Many of them have popped up specifically since the pandemic. They range from the mature Fortune 20 companies to younger startups. I am curious what your thoughts are on their role, or your role, as it relates to that new entrant, more mature retailer getting into the healthcare ecosystem with your provider organization. So you can kind of comment on it from the vantage point you sit. David, maybe I'll start with you.
Yeah, from those organizations you mentioned, I think in Phoenix Children's at least, we cannot keep up with demand. So we cannot hire enough people, we can't build enough hospitals, and our core mission is specialty care. So we welcome all those players to come to the market if they make it easier for the family to get care, because the worst thing that can happen for us is that patient doesn't seek care, they get sicker and sicker, and they come to us in a crisis, because then everybody loses in that transaction. So for us, and we can't build thousands of urgent care centers, it's just not practical. We need to focus on what we need to do. So in that area, we're very open to that. I think for us, quality is important, right? And making sure that quality care happens and you're not getting a provider who's never seen, for us, a child in this particular case and trying to treat them and then very bad things happen. So from our perspective, it's about trying to maintain that quality, but fundamentally supporting that community and helping that it thrives. And if they can do it better, all power to them. We'll focus on what we can do well.
Absolutely.
So when I came out of training, I actually joined a startup, and one of my mentors said, no one ever went out of business because they focused too much. Now, you may not be the biggest business, but at least you're still going to be in business. I think integrated delivery networks are in this reflection point right now. I mean, historically, we provide all forms of care to all folks. But that's progressively going to become, I think, untenable. And so do we need to continue to focus and narrow down what we do? Now, the downside of that is when you don't own the platform, and if you cede the platform to the new entrants or the newer entrants, then you would just end up downstream on the platform. And so that's that risk point that we're at right now. The issue that comes down to is, though, and I think this is where there's reimbursement questions that have to be thought through, and I think reimbursement has to be thought through last. What is the right clinical model first? But I think that's the piece that we need to get squared away in our head is what problem for the consumer are we trying to solve? If we're trying to manage their overall care, then we need to manage their overall care. If we're trying to provide acute care or specialty care, then we need to provide acute care or specialty care. You can't be everything you want. Right? You can be anything you want, but you just can't be everything you want. So I think that's where we need to eventually think through and focus.
Yeah, I would add two things. One, I think when you look at these kind of the startups or the emerging companies, as you mentioned, and we are one, although we have a bit of an unfair advantage in that we were born out of a large health system in Providence, so we were able to kind of work on problems we knew that existed and then apply them to others. But most of these organizations, they're relatively low, they have relatively small capital bases. The financial environment that's impacting most health systems is also impacting a lot of those organizations. So there's a lot of falling knives out there, and I think it is challenging for health systems, like the set of organizations to work with to try to help advance innovation, how we defined it here, is getting tighter and tighter. So that's sort of one issue. I would say a second issue is the large disruptors, the Amazons, the retailers, the Optum was discussed earlier, those kinds of organizations. In addition to I agree with Tarun, they're cold-blooded executors. Another area where they're able to be really good cold-blooded executors is they see what the market is doing, particularly when you're talking about technology-driven point solutions, and then they just watch what happens, and then they either copy it or they just buy it. And if they don't particularly like the company, they'll just buy the engineering team in an acqui-hire, and then they'll just move faster. So I actually think that we've had, we're kind of on a down cycle right now, but we've had 5-10 years or so of digital health investment, a bull market with digital health investment up to 2022, and it's created a bunch of supply of product, if you will, that I think you're going to see more and more. It's empowering these large-scale disruptors that makes them more of a threat, and all the more reason that health systems need to, play the playbook they are and better to compete.
Just kind of one last point to close it off is I think the other element of this is these big companies can often be cold-blooded levers of the market. Yes. We've all seen this happen. I can remember 10 to 15 years ago when Google and Microsoft were going to be the EMR vendors, and I think you have to be cautious if you kind of rely on that player that when they suddenly evaporate out of the market very, very quickly, who's going to fill that gap?
Absolutely. Yeah. Absolutely. Yeah. All right, so I'm going to poke on this one because it was one of the questions from the morning session, and I think Suraj did a great job fielding it, but I'm going to throw the ball back to each of you. I think of some of those large disruptors that we're all reading about, in online and in reputable news sources, as well as kind of those of us who are kind of really plugged into the digital community in terms of conversations. Curious who you think is the most looming threat, and at the same time, I'm curious to see who do you think has kind of the greatest opportunity. So you can answer either of those questions: looming threat, greatest opportunity, or just pick one. But I have a feeling I've heard at lunch today as well at a couple of the conversations, this sort of like, who's out there, who's really kind of looming in my space is something that folks are talking about. So I'm curious if you are comfortable being bold with the name.
I can go first. Sorry, I 100% completely agree. Optum, by a long shot. CVS/Walgreens in that distant second category. I think the only thing I maybe would slightly challenge her on is, I think she put Walmart as a competitor. I think they could be an interesting partner, perhaps, because they're really focused, right? They're really focused on very specific demographics, psychographics, more specifically. We don't really necessarily, where we are Virtua in southern part of New Jersey, we're not really necessarily competing with them. So if we wanted to supplement and get some penetration into the markets where we don't necessarily have today, I think Walmart could be an interesting concept. And I think Amazon is also an interesting concept, although I think that plays into but you don't own the platform, they own the platform. So maybe that's where I would slightly disagree with her on that one.
Yeah, I would say I agree. Optum is the biggest threat. Although particularly for this panel, digital health panel, I mean, I don't particularly look at Optum's model as particularly digital, right? I think the playbook they're running is we're just gonna own 7% of the providers and go into 10%, and we're just gonna suck the oxygen out of the market and own a fully integrated network, and that makes them incredibly dangerous if you're a traditional fee-for-service organization or have some number less than 10% of providers out there, which is kind of everybody. And so I think they matter, but from an innovation standpoint or a digital standpoint, I think the biggest threat is all of us that are just in the industry already. Because if you look at what people are really asking for, right? You take a kind of a problem solution design approach to it. I mean, people are just asking to not have to wait forever to see a provider, to know whether or not they even need to see a provider, to just buy the thing they want to buy, to be able to be taken care of, to have it not be so hard. Like, people are asking for really basic things, and I know we all know this, and this is the consumerism, driving this space. But what people are asking for is, or maybe the other way of looking at it is, I think what the innovators are trying to do, or these other innovators, that you mentioned, the retail and so forth, is they're trying to just apply this convenience model, right, to healthcare. I think it's a lot harder than they think it is going to be able to do that, and there'll be a lot of damage along the way. But really, the threat is us as an industry not realizing or not waking up to the fact that people, they're asking for some really basic things, super hard to do in healthcare because of the way the model's set up and payment structures and all those things. But like, we've got to get out of our way to be able to solve the problems.
So true.
Yeah, I couldn't agree more. I think the insurance companies are always scary. We're always fighting with them. There's always some kind of contract renewal. It's kind of always been the way it is. We know what that looks like. But I think ourselves are our biggest challenges. Again, I can't tell you how much because I'm more operationally focused. Our inability to change, and effectively we've spent 30, 20 years building a system that works for us as providers and fine-tuning every single part of the process to what works for me. And the patient's lucky to come in. We're the almighty people. You're going to be honored to come and waste an hour of your days with me and wait half an hour for an appointment. There's lots of reasons that happen, but we've been able to get away with that process for a long time. And if we don't, I tell the doctors all the time, if we don't change ourselves, someone will change it for us, and then it's going to be too late. Now, you'll still always need physicians, but all the stuff that goes around it can be optimized. And if we don't do something better, people don't want to drive in Phoenix at least 60 miles to a downtown clinic where they spend another 3 hours just to get a 10-minute visit with a doctor and a prescription. That's just not going to work.
Absolutely. So building on the threat of those disruptors and really the opportunity for partnership with them, with ourselves, I love the Warren Buffett quote that says, partnership is not a legal contract between two equal individuals, and it's emotional alliance between two people who are committed to each other's success. So if you sort of take that opportunity to think about partnership, and partnership can be broad. It can be with another health system. Partnership can be with a large digital disruptor. Partnership can be with a small technology organization. I'm curious, thoughts on kind of pooling resources, partnership, and to really improve patient experience, to really improve clinical provider experience. Derek, you want to
Happy
take
to
that
start,
one?
yeah. So before I got involved, actually Sarah Vasey, who was on stage earlier today, she and her colleague there, Aaron Martin, created DexCare as an access platform. And the idea was always solve some problems inside of Providence, particularly make access easier, and start optimizing resource on it. But the idea was always spin it out and have other health systems benefit from that as well. So I do believe that the challenges in this space are large enough that it does require kind of all hands on deck to be able to do that, and partnerships. And there's a lot of variation on how you do that. But I think if you look at like the organizations we were just talking about earlier, there are some, again, the Optums of the world that are trying to just kind of do the full stack, which is I think challenging to do. But most of those organizations, even Amazon, like the moves they've made, right, with pulling down care and then setting up clinic. Actually, it looks kind of the same on the outside, but when you get into it and you chat with those guys, it is a different model. It's a marketplace model. Yeah. They're not in the mode of trying to deliver care despite the one medical thing, and that's sort of a tiny piece of the big vision. And so I do think that like most of the organizations, including the large ones, like understand that. I mean, it's a multi-trillion-dollar industry. Like, it's ridiculous to think of one organization owning the entire thing. There's an EMR company that thinks that, but like other than them, right? It's ridiculous to think of that, right? No, go ahead.
Yeah, I mean, certainly in children's hospitals, it's you would think it would be easy to partner. We only have really one children's hospital per state for the most part, and we're not competing. But the challenge we face in that is while there'd be great synergies bringing together, the egos of those hospitals and the people that work in them really, really get in the way. I can't tell you a number of times each of us developed great solutions that we'd be willing to give away to other people, but the barriers to get through that with I've already done that better, or yes, that's interesting, I'm going to do it differently. Also see that with big software EMR vendors too. You show something innovative and they're like, I can do it 15 times better, and then 3 years later it's not come out yet. So I think our partnership's an opportunity. We give a lot of lip service to it, to your point. Both players have to come in equally, put their egos aside, and I think we're not really quite there yet in the field that I operate in.
Personal preference of to partner with the big names versus the small, scrappy startups. My personal preference is the latter, because I like to be able to text the founder and the CEO and say, what is this? And so that's what I always look at. I was like, which throat do I get to choke? It's a bit offensive, but it is reality true. Because me working with the sales rep doesn't do it for me. On the flip end, though, but everyone's a little bit different, and then what is your risk tolerance to work with those two? And again, traditionally, I picked IBM because no one ever got fired for picking IBM, except IBM was building mainframes, and so you should have been fired for picking IBM, right? So I think what is your risk tolerance to do that? And again, something that we celebrate failure. I mean, that's the most idiotic statement on the place. No one should ever celebrate failure. People should celebrate the lessons they learn from failure. But if you fail because you didn't do your diligence on somebody, then you should have your so-and-so handed to you. And so I think that is what you have to look at is do your diligence on your partner on it, because you don't have any recourse against them, right? And if you're picking them, most of the time, it's not even worth going after that. So just pick diligently and then fail together and learn together with them. That's I think the approach that I think works best.
Okay, I am just going to take a commercial break and say that we only have 10 minutes and we haven't said AI or any type of advanced analytics in this conversation yet. So just keep that in mind as I tee up the next question. So within the digital health space, there's lots of customers, right? You could have your patients and your caregivers as your customers. You could have your clinicians if you are a research-based institution. You could have your researchers are your customers. The business is your customers and your workforce. let alone the contribution to the larger healthcare ecosystem. When we think about digital and your customers and kind of the work you're each leading within your organizations, I wonder how you think about your customer that you're designing for, really understanding deeply their pain points and problems, as you're thinking about either building solutions or partnering with one of the companies we're mentioning. So if you could kind of tease out for me a little bit about maybe your top 1 or 2 customers and some of the needs you're trying to work on that are important to you that you're solving for. Tarun, do you want to start?
I can take a first pass. We use a triple model, a triple consumer base in healthcare. So we use the term patient consumer, clinician consumer, staff consumer, so meaning internal staff. We've made mistakes where we solve for one of the consumers and we ignore the other 2, and it's come back and bit us bad. A perfect example for this is, hey, you can now message your clinician through their portal, and whether it's MyChart or Cerner. Great for the consumer, patient consumer. Ask your clinicians what they think about that, right? Because now they have exponentially more messages to answer. Oh, and by the way, they don't get reimbursed for that, or we don't reimburse them, and we didn't carve out any more time for them to do that. Now, we had looked at it from a triple consumer perspective. We said, okay, well, we disrupted one, or helping one, but at the expense of the other 2. Yeah, no wonder there's burnout. Then we could have spun it and say, okay, well, why don't we solve it differently? And the problem now is that people are coming back reactionary and say, well, now we're going to come back and we made it bad for 2 of the consumers, so now we're going to make it bad for the 3rd consumer by charging them for sending a message. Right? It's like, yeah, right, that's a really good way, right? Instead of elevating up, we're going to bring everybody down to the same level. So maybe that's not the direction we should go with that. And maybe we should pause out and say, okay, let's figure out what are the ways. But I think you could, at a minimum, look at those triple consumers. You can make an argument, I think, that there's a 4th consumer in that, and that's the payer, not the insurer. The payer and the insurer are 2 different things. The payer is the people who truly pay it. It's either the government or your employer who pays for your insurance. I think that's a 4th dimension that is probably worth adding in.
Yeah, I think rather than trying to define specifics, that if you're trying to take an analog process and move it to digital, it's the people that are impacted by that. And if you only focus on one side of the equation, you'll get these home monitoring solutions where you ship a bunch of equipment to someone's house and the person doesn't even have Wi-Fi and the doctor has no time to look at the results. And I think we often fall into the trap of, we wouldn't admit it to ourselves, but the customers are often the C-suite person that the sale is being made to. And if that C-suite person is very affluent and can understand it and is excited by that technology, that's often, they think, oh, I'm the customer. I'm the one being sold to. I like it. I will buy it. That's a big trap. And we have to have everybody on both sides, because if on one side of it doesn't work, you may as well not do it at all.
Yeah, I think all these problems that we're trying to work on together, at the end of the day, we were talking with Tarun about this at lunchtime. We're trying to define best, right? Best care, best treatment, best appointment, best experience, and that clearly is so multifactorial, so huge, subjective, no matter how much data we try to put around it, that I think it requires 3 things. One, I agree with Tarun, it's got to be multi-stakeholder. We focus on access. We love patients. We think too much access is driven by just what the patient wants to choose, right? Where's the provider in the equation so they don't get burned out? Where's the health system in the equation so they don't go out of business on, people inappropriately routed? So one is multi-stakeholder. 2, getting folks from outside the industry connected to it. If we're concerned about the Amazons and the Walgreens, the Walmarts of the world, get those organizations involved to learn from them, run their playbook. We bought a company at DexCare's last year who did a little bit of healthcare. But what they did do is they created a bunch of e-commerce experiences for large retailers around the country. Harley Davidson selling leather jackets, Zale selling rings and so forth. It's been great. We take learnings from there, we take that shopping cart, we find a win, we take out a leather jacket, we put a doctor's appointment in it, and we can merchandise it a lot better. And so you start learning from others is really important. And then the 3rd and final thing is every single customer we work with, we do all of that, and there's always a gap. And I think any technology vendor that tries to work with health systems to solve these problems, given the enormity we're talking about, anyone that comes there, no matter how large they are, and says, don't worry, we got it now, or it's on our road, we're going to have it, tomorrow, don't worry about it. They're being disingenuous. You have to co-develop with your partners to create the future that you're envisioning together, because the problems are just too big here, and they're too subjective to do anything less.
I love it. I think that co-development piece, whether it's one of those large disruptors, it's a young new company, somebody's going to really work with you on your roadmap, deeply understand the pain points. And as we talked about, right, the three of us have talked about it, our patients, our workforce, are digital consumers in every part of their life, in every other vertical. And so we need to begin to think about how we're equipping them with both the tools and the experiences, and that it works on both sides of the coin. So it's not just helping the patient, but it's helping your workforce, right? And then ultimately, it also helps your business. So we've got some great questions. We're running a little short on time, but let's try to tee up a couple of them. And I really like the first one. It says, what do you consider the top specific innovation initiatives that really move the needle? So agnostic to the who, just the opportunity for those innovations to really move the needle.
Well, a year ago, if someone had said AI and ML, I would have thrown things at them, just like much of the response here. I'm so tired of that under-delivering space, but I am 110% believing that generative AI is going to so broadly impact how we deliver care, not necessarily the physician and the diagnosis, all the things people talk about, but just the fundamental shift in the administrative component of delivering healthcare, that is going to far exceed any other particular initiative and how it goes. And I'm not talking about ChatGPT, which often people like to quote. That's a disservice to the technology. I think it is going to be massively disruptive.
I concur. In the morning, there was the question of which disruption or which technology, and for the folks who voted for the incorrect answer, which was the incorrect answer was interoperability, the correct answer was AI and robotics. I would challenge you to think about it as interoperability. Well, okay, that's great. That's assuming people want to come to you. And I want to challenge people. Why do people have to come to you today, or us? And us, I should actually say us today, is because they don't have anyone else to do that. I think somebody asked me once, Tarun, what does it mean to be a doctor? And I gave this Miss America answer. Well, it means that it's the heart and the enjoyment and the art of the science behind it. And then they asked me, said, in the state of New Jersey, what does it mean to be a doctor? I said, it's my medical license. As soon as we disrupt that concept of the guild, and that's fundamentally what it is, right? Medical practice is a guild. As soon as we disrupt the guild, and we are starting to get at the tips of disrupting the guild, this changes dramatically. There's a reason why there is not interstate licensure today, because President-elect of the AMA is no longer here, I believe, but it's to protect the guild. So once we start getting to that space, I think that becomes a level of disruption that just completely blows the thing. Oh, imagine if we even went international with that too. So I think that's a place that will be really interesting. Yeah.
Did you want another question?
Yeah, I'm going
I
to
know
grab
we're
one of
almost
the
out of
questions
time.
versus have everyone.
Yeah.
Yeah, so I'm going to pick one at the bottom there. It says, what industries really nailed this consumer centricity in your opinion, and why? So when we talk about disruption, we say patients and our workforce are digital consumers in every other part of their life. I wonder who you think has nailed it.
Yeah, I mean, so again, we're focused on access. I think the e-commerce company, we talk about Amazon and others, I think they've nailed consumer centricity. And I think that's not enough for healthcare, right? I mean, again, back to the patient preference. I can make it so you can get exactly where you think you need to be, and it can be a miserable experience for you and the provider and the health system. So there are great consumer-centric companies out there, and it's not enough for what healthcare needs.
Yeah. All right, we'll take one more. We've got a little bit of time. What are these new entrants doing to be more consumer-centric specifically, and realistically, how long will it take an incumbent healthcare providers to reach that level of the consumer centricity? Anyone want to take that one?
One thing I would say is COVID was a complete eye-opener in terms of willingness to adopt, just to have a burning platform. We couldn't get people to adopt telehealth for years before. 10 years we had that technology. No one wanted to know about it. Within 2 weeks after people come to the hospital, people needed a paycheck and needed to see patients, and boy, we had 70% of our appointments there. So I think there's nothing like a good burning platform, and I think a lot of healthcare systems are in financial trouble right now. This is a great opportunity to reevaluate. If you're spending $150 million on an EMR, are you getting $150 million of value? And all those, so these burning platforms, this bad financial time that some people are in, is a great opportunity to really strike at some of these new technologies.
Great answer, great answer. Should we see, I'm at time. Did we hit? I can do the last one? Okay, great. Should we see these big pharma and big tech companies transitioning into care delivery as a threat or opportunity partnership? I think we kind of talked about the opportunity and partnership before. Anyone have any final thoughts on that one?
Typical operating margin for a pharmaceutical company is probably in the 20% range. I think for a tech company, north of 30% range.
Yeah.
If we eke out 1% to 2% per year in integrated delivery space, that's a really good year. So yeah, welcome to the jungle, to the pharma. If you're good with this, right? Now, you know who is good with it? Walmart's really good with it, single-digit percentages points. So I say, welcome to the jungle, but the thing is that you got to play in the entire space. You can't just pick off what you want. And that, I think, is where we're going to have to really thread the needle very carefully.
Dr. Kapoor, David, Derek, thank you so much for joining me today. I really appreciate it. Thank you.
Let's give it up for this awesome panel, guys. Jodi, wonderful job. Thanks, guys. If you want to exit on out, please.
Thanks.